Zygoma implants can be life-changing, not just for patients but also for their entire families. Let me narrate another story about a patient who came from Australia. This lady had researched, had Googled and found a center in India, in the northern part of India, and she came to do a full mouth implants, that is, to have implants for both upper and lower jaw and artificial teeth. So she went through the procedure, and when she came for a review after a few months, they noticed that she had lost a few implants. Some of the implants are not integrated well to the bone. They are not fused very well to the bone. So they removed those few implants, and with whatever other implants that were left, they put back her artificial teeth. Within a couple of weeks, few more implants became loose and the denture, her artificial teeth became very shaky. So she was literally in tears because she had spent her time, her money, and she had traveled already 2 times to India from Australia, and she was nowhere near a solution. So when we saw her, when she reached out to us, we asked her to come for an opinion, and we did some investigative tests. We did what's called an advanced CT scan called a cone beam CT scan, which has much less radiation than a conventional CT scan. And then we realized that her bone condition, the upper jaw bone condition, was not great. She had what we call as osteoporosis, and she also had less volume of bone. So having analyzed all that, we realized her best solution would be to go for a Zygoma implant. So we talked to her, we got her consent, and we went through the procedure. What was the procedure? We went in, took out all the other implants that were not very adherent to the bone, which are not fixed very well to the bone, cleaned up all the infected areas, did Zygoma implants and few other conventional implants using a different technique. And within a matter of 4 days, we gave her a new set of fixed artificial teeth. So not only could we regain her confidence, we regained her trust in the Indian doctors. She went back to Australia, came back 8 months after that to do what's called a second stage procedure. Because in stage 1, we give only artificial acrylic teeth. In stage 2, we make it into zirconia or ceramic teeth, which are lifelong, really. So this patient, when she finished the second stage, she was so happy that she is now today almost like our brand ambassador in Australia. She visits us every year for an annual checkup, and she's doing very well. And she's one of my most compliant patients, maintains very good oral hygiene, follows our instructions diligently, and she's one patient whom I'm very happy about, since we could restore her confidence, restore her smile, restore her happiness. So such stories are not few and far between. We see them more and more nowadays. I've had patients who have come from United States. I've had a nurse who's come from United States who came all the way here having learned that we do a very advanced level of implantology. And a few years ago, I was awarded the honorary special fellowship of the American Association of Oral and Maxillofacial Surgeons. So that gave the confidence of some of the patients that, we practice a high level of implantology. So you heard this version of a patient from Australia. In the next episode, I'll talk about some patients from different parts of the world, from USA, from Switzerland, etc. So, if you have a question, if you have a doubt, if you have a need, especially regarding Zygoma implants, feel free to reach out to us at Rajan Dental.